Is there a limit on the time an individual might continue to take pain relief?
Again, the nerve pain medication all have quite a lot of side effects, so they need to be titrated quite slowly. And I would always see, if they get 30% pain reduction, which will be my cutoff, to recommend, the long-term use of this medication. It's always a balance between the benefits you get from this medication and what you want to put up with the side effects. But I think 30% is quite good guides, because that's what normally placebo responses generate as well in clinical trials. And then, I think good practice is to review medications every year or so, if that's the fulfilling, the purpose you have patients put onto these drugs. And they are not tablets, who work in everybody, so you need to find out which type of anti-nerve pain medication works for the individual patients in front of you, and don't continue with it if it doesn't actually work. I think that's the main guidance, I normally use.
Okay. I have fairly excruciating pain in my right hip and knee. I've tried pain relief, I've tried some natural forms of pain relief. Is there anything else that you would advise?
Again, like I said in the beginning, is that there is different types of pain. So this kind of pain could be arthritic, because the muscles around the hips and the knees have been weakened, and then the arthrosis or the arthritis, in the different joints have been accelerated because of the weakness. And then the treatment, would be again physiotherapy, and I probably would like to try a small amount of strong painkillers, taking side effects like constipation in mind. But they can be quite effective in this type of what we call nociceptive pain against, nerve pain. But on the other hand, if you have got some damage in the spinal cord, which looks after this area of your hip and knee, it could be neuropathic pain. And again, it would be quite important to make the appropriate diagnosis, because for the nerve pain, I would then use different medications and not necessarily opioids in the first place.